Hello friends, I am Dr. Swapnil Tople. I am consultant urologist and andrologist. Today we are going to discuss on important topic what is called as urinary retention versus anuria. So many times patients get confused about the urinary retention and anuria, that means no production of urine. So these are two different entities but they are very overlapping. Sometimes these diagnoses can get confused with each other. So what is urinary retention and what is anuria? So urinary retention means the kidneys are producing the urine but urine is unable to come out of the body. And anuria is what? The kidneys are not producing urine at all. That's why there is no urine accumulation in the bladder, and that's why the urine is not coming out of the body. So these are the two different phenomena. So how can one decide that he got an urinary retention or anuria? So what are the symptoms of those two entities? Urinary retention, patients will have typical difficulty in urination. They will have a sensation that there is urine, the urine has stuck, but they are unable to pass it. There would be abdominal distension. The patient will have uneasiness. They will have perspiration, raised pulse rate, blood pressure, and they will tell that they urgently need to pass urine. But in case of anuria, the patient will not have strong urge to pass urine. Abdomen will not be distended. They feel that they are still bladder has to be filled up, and in that case, patient can have edema, that is swelling in the hands and foot because of the water which is not filtered by the kidney will be retained in other body parts. So these are the two different aspects. So how can one treat these conditions? So your urologist will advise you certain tests after doing the thorough clinical examination. On examination, he can find abdominal distension, bladder is full in case of the urethral obstruction, that is the retention of urine. But in case of anuria, the bladder will be collapsed. So he will advise you to do certain tests like ultrasonography, urine routine microscopy, renal function test. So these are the commonly performed tests. With these tests, one can come to know what is the exact diagnosis of in those two conditions. So for the abdominal retention, that is the urinary retention, in that case one has to relieve the obstruction after identifying the cause. While in anuria, one has to find out the cause of kidney failure, what is leading to the kidney failure, and those causes will be treated accordingly. I hope these two conditions are clear now. Thank you.